Well, keeping moms and babies healthy, regardless of their background or race, is the driver behind a new bill being pushed by Congresswoman Jahana Hayes in Washington.
According to her office, research shows the United States has the worst maternal mortality rate in the developed world. That rate is alarmingly higher for Black women, with pregnancy-related deaths at 3 times higher than white women.
So joining us now to talk about this crisis and what can be done to save lives is Congresswoman Jahana Hayes. And Representative Hayes, we certainly appreciate your time. Let me ask you first, just describe the maternal health crisis in this country.
Well, thank you so much for having me. And I had no idea how staggering these numbers were until I came to Congress. As you mentioned in the leading up to this segment, Black women, Native American women are 2 to 3 times more likely to die from pregnancy-related complications. The CDC says that 60% of these deaths are preventable. We have access. We know what the problem is. We know what tools are necessary. We just have to really just have the will to address these issues and make sure that we make targeted investments in the communities that need it most.
You talk about a whole of government to develop comprehensive strategies. Tell us why we need that approach.
Well, it's quite simple. It's not just genetics that are the drivers for these complications. It is where people live, where they work, access to nutritious foods, all of these things that really put women in the healthiest position to give birth and to have access to high quality health care. These things are absent in many of the communities where Black women live. So it further creates complications during pregnancy. So making sure that we are not just looking at the medical implications or the genetic implications, but like I said, a whole of government approach, creating a fund to address the social determinants in the community that affect pregnancy complications, setting up a task force to make sure that we are tracking the data and responding in real time before we lose any more women or children to complications associated with childbirth.
All right, Representative Jahana Hayes, thank you for joining us and good luck with your legislation in Congress.
Thank you.
Thank you for having me and for amplifying this issue.